What we now call Parkinson's disease was described by James Parkinson in 1817 as the shaking palsy. He noticed about half a dozen people walking around the streets of London who seemed to have the same illness. They walked slowly and with a shuffle. One or the other limb would be shaking. The shaking or tremor of Parkinson's disease is very characteristic. It is a rest tremor. It affects the part of the body when it's not being used. For example, an arm when resting on a lap or on an armchair, or a leg or foot when it's resting on the ground. The walking is characterized by short steps, shuffling. Sometimes people have difficulty getting their steps going. Curiously, although Parkinson's disease always eventually affects both sides of the brain, it usually begins on one side. When the leg is affected particularly, it may give rise to a dragging of the foot or leg when someone is walking rather than shuffling, and people can be mistaken for having a stroke. A tremor that begins in the arms mainly when using the hands and both sides at once without any slowing of movement or difficulty with movement is usually not Parkinson's disease, but something else, a less severe illness called essential tremor. We now know that Parkinson's disease is not only a motor disease, it is a whole body disease. In the earlier stages, even before movement is affected, it might affect someone's sense of smell, it might lead to someone becoming very constipated, it might affect the sleep, particularly the phase of sleep when someone is dreaming. Usually we paralyze our muscles when we sleep, but in people with Parkinson's disease, that process fails, and people can yell out or thrash around when they're dreaming rather than lying still and only moving their eyes, the rapid eye movements. We also know that Parkinson's disease can affect mood. People can become very anxious or sometimes very depressed for no particular reason, and this can also precede the motor symptoms by a number of years. So what should we do in someone that we suspect might have Parkinson's disease, or if we suspect it in ourselves? Not everyone who loses their sense of smell will have Parkinson's disease, nor everyone with constipation. So the thing to do is to seek medical attention, seeing a family doctor or sometimes a specialist. Parkinson's disease is important to diagnose because its symptoms are very, very treatable, and with effective treatment, we can restore quality of life and function.